Did you know that a lot of nurses are not correctly flushing their central lines? For this week's tip of the week, we are going to be talking about a flushing technique that you should be using whenever you are flushing your patient's central line. And this technique is called pulsatile flushing, also known as a push pause method or stop start method. So let's talk about why we do this method versus just a traditional flush where you just flush it in. When you use this push pause method, it creates turbulence in the line to help clear the lumen, that internal catheter lumen, from any fibrin buildup, blood buildup, if there's any bacteria that's beginning to colonize, basically any residue that's in the line that could cause either a blockage or an infection. This helps improve catheter patency. So you can definitely tell when you flush a central line when there is some resistance there, prevents occlusions. So, clots building up, as well as infection prevention, because again, we are clearing if there's any bacteria that's beginning to colonize in that line, we are knocking that out. So, how you perform a pulsatile flush is instead of doing that continuous flushing motion when you are flushing a central line, you are actually going to pause after each milliliter and kind of bolus, so to speak, 1 milliliter at a time to create that turbulence in the catheter lumen. And that is your tip of the week. Let me know if you have any questions.